This one I think is really cool. No one's doing it, just so you know. I'm probably the only one, but that's okay. It's going to catch on. BPC-157 and autism spectrum support. I know what you're thinking. That's nuts. Yeah, it's not so nuts. Almost everybody that has a kid that has autism or is on the spectrum will tell you that there's a gut-based problem. It's kind of where the leaky gut syndrome term started in the autism world. So it helps with gut healing, it helps with neuroinflammation modulation, and it helps with nervous system repair. That's what BPC-157 does. All of those are part of the autism spectrum disorder. Here's some context. Autism spectrum disorder, ASD, it's not a disease to be cured. It's a complex neurodevelopmental condition which is influenced by genetics, environmental immune signaling, gut health, and nervous system regulation. In functional medicine, our goal is to reduce the physiological stressors that interfere with brain function and regulation, allowing each individual to express their highest potential. BPC-157, guys, is not an autism treatment, but it supports the key biological systems commonly dysregulated in autism spectrum disorders. So what is BPC-157? It's a naturally occurring peptide that helps with the body's tissue repair signaling, gut integrity, immune signaling, nervous system healing. It acts as a biological repair signal, helping the body restore balance where inflammation or injury has disrupted normal function. So why should you consider BPC-157 an autism spectral disorder? Well, many individuals on the autism spectrum show overlapping physiological problems and patterns. Number one, leaky gut, gut barrier dysfunction. Number one, it's seen in every autistic kid that I've treated, and I've treated thousands of them. It is absolutely imperative to heal the gut. Chronic neural inflammation caused by leaky gut syndrome, altered immune signaling. Could be also part of this whole gut problem is that it impairs immune signaling. Vagal nerve and autonomic imbalance, impaired tissue repair, and oxidative stress. BPC-157 may reduce the burden on all of these systems, indirectly supporting neurological regulation. So, key mechanisms. The gut-brain axis support. The gut and the brain are deeply connected. We've talked about this before. BPC-157 may support the healing of the intestinal lining, improve the gut barrier integrity, reduce the inflammatory signals originating from the GI tract, and support communication between the gut and the nervous system. This is important, guys, because this gut inflammation can amplify behavioral, sensory, and cognitive challenges. Think about all the stuff that the gut does. Think about the serotonin. Think about the dopamine. All this stuff in the gut. It's so important. Neuroinflammation modulation, chronic low-grade brain inflammation, commonly observed in ASD. BPC-157, what does it do? It modulates inflammatory signaling rather than suppressing immunity, supports healthier cytokine balance, and it may help calm overactive inflammatory responses that affect the brain. Kind of important. Nervous system and vagal tone. The autonomic nervous system, fight or flight, or versus rest and repair, often dysregulated in autism spectral disorder. BPC-157 may support nerve repair and resilience, improve vagal nerve signaling, help stabilize the stress response, and support improved regulation rather than stimulating. Number 4, tissue repair, oxidative stress reduction. Individuals with autism spectral disorder often show increased oxidative stress, impaired cellular repair mechanisms, and BPC-157 supports this. It supports mitochondrial resilience, cellular repair signaling, improved blood flow to healing tissues. What does it not do? It doesn't change genetics, guys. It makes your genetics work better. It upregulates things. It does not treat autism. Nothing treats autism. We're not treating it. We're treating the stuff related to it. And then hopefully that will get rid of the disorder. It does not replace behavioral development or educational therapies, all really important. It may reduce physiological barriers that interfere with regulation, learning, and adaptability. So it helps to do all of these things below the level so that the educational stuff, the developmental stuff, the cognitive stuff, all that stuff works better. So how do I use it clinically? When we use it as a part of a broader individualized plan, often alongside gut healing protocols, microbiome support, nutrient repletion, detoxification support, nervous system regulation strategies, and behavior development therapies, It's never a standalone solution, but a supportive tool. So the bottom line is, if BPC-157 helps support gut integrity, inflammatory balance, and nervous system repair, 3 systems commonly stressed in individuals with autism spectral disorder, by supporting the body's internal repair intelligence, we aim to create a more stable physiological foundation for growth, learning, and regulation. BPC-157. It's a really good tool.